Hello, everyone. My name is Melanie Hecker. I am the statewide youth and young adult advocacy specialist with the Office of Advocacy and Peer Support Services at the New York State Office of Mental Health.
Hi, everyone. My name is Olivia Knox, and I'm a project administrator on the workforce development team, the community workforce development team at the Office of Mental Health.
And we are here today to give you an overview of New York State's Youth Peer Advocate Credential. Now, the amazing thing about the Youth Peer Advocate Credential here in New York State is that it was developed by youth, for youth, to meet the needs of youth. In this presentation, I'm going to go over what a youth peer advocate is, some of the activities they do, the settings that they work in, and what the youth peer advocate credentialing process is like. So, first of all, what is a youth peer advocate? A youth peer advocate is a young adult aged 18 to 30 who has experience in the mental health system and other child and youth serving systems. And a youth peer advocate provides a variety of services, including but not limited to emotional support and advocacy to children, youth, and young adults with system experience. There are a lot of different child and youth serving systems that YPAs work in. Mental health is the primary one, but YPAs also work in addiction recovery, special education, immigration services, juvenile justice, child welfare, including foster care, disability services, and in healthcare settings such as hospitals. Activities of YPAs may include, but are certainly not limited to, providing one-on-one emotional support to a particular person, facilitating emotional support groups, helping the young people that they serve advocate for themselves, responding to mental health crisis, often as a part of a crisis response team, helping young people build life and career skills, such as helping apply for a college, apply for jobs, determine a career path, providing vocational assistance. And earlier we were talking about bridging gaps. Well, a youth peer advocate can help bridge the gap between a youth and a provider in a variety of settings. There are 5 YPA billing categories. These billing categories include skill building, coaching, engagement, bridging, and transition support, self-advocacy, self-efficiency, and self-empowerment, and community connections and natural supports. There are a wide variety of settings that YPAs may be employed in. These include hospitals, schools, whether high schools or colleges, residential programs for children, youth, and young adults, courts, crisis response programs, and pretty much anywhere that wishes to hire a YPA, any type of program or setting that they think might benefit from having a YPA available. So I'm going to talk a bit about the importance of YPAs in addressing the youth mental health crisis. YPAs are able to provide support from the perspective of somebody who has experienced the same type of challenges of the person that they're serving. That provides a unique perspective and role that clinicians aren't always able to provide themselves. And even in the rare situations where the clinician can provide that perspective themselves, there being an equal power dynamic between the peer supporter and the service recipient leads to an easier, more freeing feeling than receiving from a clinician. The YPA assists youth with navigating complicated systems and choices. It goes without saying that state systems can be very complex in the types of choices you need to make, the types of settings you need to navigate, the rules, the regulations, the guidance. It can be overwhelming, but a YPA can help serve as the guide through those choices. And they're able to, from the perspective of a peer with the same types of experience, guide youth in planning their adult lives in recovery so that they don't just survive, they thrive, they attain their life goals and ambitions. And this can include, as I mentioned earlier, professional development, education, and independent living, whether it's finding apartments, learning life skills. So here's a bit about the YPA credentialing process. YPAs start by receiving their provisional credential. After 600 hours of volunteer or paid service and completion of the level 2 training, YPAs can apply for their professional credential. And the YPA credential is administered through Families Together in New York State, a statewide not-for-profit that focuses on family and youth advocacy in mental health and disability systems. So, some beginning things about the YPA credentialing process. There are no application fees for YPA credentialing. And while the YPA credential process is self-paced, it typically takes about 1.5 years. And while the provisional credential is acquired quickly, the professional credential does take more time. The provisional credential consists solely of online training modules. And these online training modules include, but are not limited to, self-efficacy skills, cultural competence, group facilitation, and navigating the system. The provisional credential requires lived experience, proof of age, a high school diploma, and 2 letters of recommendation, and is valid for 18 months. And I should clarify that the YPA credential only requires a high school diploma. It does not require a college degree, which can make it a very accessible option. The professional credential process typically starts after the young person has begun working as a YPA. And it consists of both online and in-person training modules, which can include, but are not limited to, working across systems, understanding marginalized populations, building positive connections, and mentoring and coaching. The professional credential requires a supervisor letter of recommendation, and in order to maintain RUN's professional credential, they will need 20 hours of continuing education every 2 years. Major continuing education opportunities for YPAs include the annual Families Together in New York State Conference, which is held in May, and the University of Youth Power, which is typically held during the summer. Now, while YPA credentials do expire on one's 31st birthday, credits earned as a YPA can apply to an adult certified peer specialist credential. So you don't need to worry about all of your education and efforts going to waste once you hit 31. And there is a link that I have put here in the slides for more information. And that is it. I don't believe we're going to have time for Q&A, but if you do have questions, please feel free to approach me during lunch or anytime after the presentation.
Thank you to Melanie and Olivia. They've been our partners at the New York State Office of Mental Health throughout our planning grant period, and we would not have had a successful planning grant period without your support, so thank you so much. And thank you to your team, your other team members that couldn't be here today. My name is Anthony Swingruber. I'm a program administrator at the New York State Commission on National and Community Service. I'm excited to share information on the New York Youth Mental Health Corps, a collaborative initiative that's set to launch in the fall. So this program emerges out of Governor Hochul's historic $1 billion investment in mental health. And that demonstrates our state's commitment to transforming mental health care and serving the needs of more New Yorkers. As part of that commitment, the state conducted a youth mental health listening tour in 2023, hearing directly from young people about their needs and experiences. Their voices were clear and compelling, as one young person urged. We want therapists that are more our age, like peer programs and mentors. The New York Youth Mental Health Corps represents a direct response to what we heard, combining AmeriCorps service and the Youth Peer Advocate Credential to create meaningful pathways in behavioral health while expanding critical support services. So let me start by sharing why this program is so vital right now. Recent data from the CDC shows that our state and the country as a whole is facing a significant youth mental health crisis. That data shows that 57% of teen girls and 29% of teen boys report feeling persistent feelings of sadness and hopelessness. And these numbers are even more concerning for certain populations. We're seeing greater mental health risks for BIPOC youth and LGBTQ+ young people. Currently, we only have about 150 youth peer advocates across the entire state. And to put that into perspective, that's one YPA for every 4 school districts in New York. The demand for youth peer support far exceeds the current capacity. And what we've heard from young people during the state's recent listening tour underscores the need. As one young person explained, youth are more willing to open up to peers who understand their experience. The New York Youth Mental Health Corps is our response to this need. By combining AmeriCorps service with the YPA credential, we're creating a pipeline of culturally competent peer support providers while simultaneously expanding access to services. The New York Youth Mental Health Corps will represent a comprehensive career development pathway that starts with the Youth Peer Advocate Provisional Credential, which you just heard a little bit about. And by the end of a member's term of AmeriCorps service, they will have earned the full YPA credential. Through our partnership with SUNY Empire, members can earn 12 college credits for completing their Youth Peer Advocate credential. And as you learned during the panel discussion, members also earn the Siegel AmeriCorps Education Award that is tied to the Pell Grant amount, currently at $7,395 this year. And that would go for members who successfully complete their term of service. Along with completing the YPA coursework that you already heard about, the training process also includes hands-on experience providing peer support, professional skills development from supervisors in the behavioral health field, connection to employer networks, and as Melanie mentioned earlier, the Youth Peer Advocate credential also now has a pathway to the New York certified, the adult certified peer specialist certification. And that opens up whole new career pathways and ensures that individuals that age out of the YPA can continue their career. We recognize that success requires support at both the organizational and the individual level. The AmeriCorps New York support structure ensures that both organizations and members get the resources they need to succeed. For organizations, we provide technical assistance from commission program administrators like myself throughout the grant cycle. We also assist with program development in areas like recruitment and retention, and we connect our programs to a statewide network of AmeriCorps New York programs, as well as our new Youth Mental Health Corps portfolio that we're expecting in the fall. And that is in addition to the great national benefits that you heard about during the morning panel from our partners at Schultz and AmeriCorps. Members of the New York Youth Mental Health Corps, members from the New York Youth Mental Health Corps can expect to receive a comprehensive package of support. That includes the living allowance, which was mentioned earlier. That's funded by AmeriCorps, so that alleviates some of the burden of organizations. Members serving in the New York Youth Mental Health Corps will earn their living allowance, and that's going to make service more accessible. Also, the Siegel AmeriCorps Education Award for future education, the Member Assistance Program, that's through America's Service Commissions, that's going to provide mental health support for our core of members, and then professional and networking opportunities throughout the service term. This dual support structure ensures that both organizations and members can be successful and that we create a sustainable program that benefits all stakeholders. We understand that different communities have different needs. That's why our New York Youth Mental Health Corps will offer significant flexibility in program implementation for participating programs. You already heard about the variety of settings where members can serve. Just to reiterate, schools, educational programs, youth serving nonprofits, residential programs, really anywhere where youth are served, as Melanie mentioned. Someone can be a New York Youth Mental Health Corps member and engage in the credentialing process. And service delivery can be customized through individual or team-based service, virtual and in-person options, integration with existing programs, culturally specific programming. This flexibility allows organizations to design a program that best meets their community needs. For next steps, attend information sessions like you're doing today. We appreciate you all braving the cold to be here to learn more about the New York Youth Mental Health Corps. We encourage you to engage with one another, those that are already working with youth peer advocates, AmeriCorps New York programs that are in attendance, exchange ideas about best practices for program implementation and service delivery, and you'll have the opportunity to do that shortly over lunch. And also watch for our request for proposal release. That's coming very soon in the spring. My colleague Megan Russell will outline some of the steps for submitting an application to our RFP momentarily. And then awarded programs will begin program development this summer, including recruiting Youth Mental Health Corps members. In the fall, the program will launch with the first cohort of New York Youth Mental Health Corps members. For more on the RFP process, I'll pass the mic to our Director of Grants and Procurement, Megan Russell. Thanks so much for your attention and your interest in participating in the New York Youth Mental Health Corps.
Thanks all for being here, and I'm sure everybody's probably getting a little hungry for lunch, so this will be pretty brief. So yeah, as Anthony mentioned, our request for proposals is going to come out in the spring. How it all starts is the federal agency puts out a notice of funding opportunity, and it's generally at the end of the summer or early fall. So along with the notice of funding opportunity that lists the requirements and national priorities, it also has application instructions and like what to do in the certain systems, what additional information that you need to know, the mandatory supplemental information that has definitions and helpful information pertaining to those priorities and performance measure instructions. So annually, we have a competitive process where grants are typically held in the fall, and those applicants compete on a national level. In the spring, where we were talking about and that our Youth Mental Health Corps opportunity will be available is our formula. So formula grants are typically held in the spring, and the federal funds are awarded to states based on a population formula. And then the commission will manage this grant process, and applicants will be competing against each other in New York. On the screen is eligible organizations. Many, if not all of you, would fall into these categories, and these will be noted both in the Notice of Funding Opportunity and the New York State Request for Proposal. So all applications, all federal applications for assistance will be entered into the AmeriCorps portal eGrants. So this is something that, in preparation for applying for our opportunity, you could get yourselves registered in this system. System for award management. So this is another federal system. So if you receive even $1 in federal funds, you will have to be registered and maintain certification in this system during the life of the application process and beyond. As far as the New York State process is concerned, the statewide financial system is an application that all New York vendors have to be in. So this is something that you'll answer a series of questions. And then once you become pre-qualified, you would then maintain certification every 6 months. So the required documents are listed here. These are what you would need to sign up for your initial application. And then every year, the IRS 990, audit review and findings, and the CHAR 500 or 410, which is the Attorney General's Charities Bureau filings. Those are the 3 items that you have to update annually. So those 3 items will cause pre-qualification to go out of whack. And so on an annual basis, you would have to go in, update those, and then recertify. So another one of the New York State processes that one can expect when applying for grant monies is the New York State VendRep system. This is the Office of the State Comptroller system, and it's a vendor responsibility questionnaire. So these are the things that the VendRep system is looking for, whether the vendor has adequate financial resources to perform the contract, whether they have the necessary organization and experience in accounting operational controls, whether they have legal authority to do business in the state of New York, whether or not they have satisfactory record of integrity and business ethics, and then also if they have acceptable performance records on past contracts. So overall, as we spoke, the Notice of Funding opportunity has already been released. We right now, as New York State, has just submitted their application for competitive funding for this fiscal year 25. In the spring, we'll hopefully release the request for proposals, which will have this youth mental health opportunity in it. And then so applicants will put in an application in eGrants for the first year, and then subsequent years they would have to put in a continuation application, which is answering narratives on 5 questions as opposed to an entire narrative. And then at that point, then they would request level or additional funding for out years. So as far as New York State is concerned, you would apply once to an RFP. So if you applied successfully once to this spring's RFP, you would not have to, in theory, have to apply to another or respond to another RFP until 3 years after. However, you would have to do an annual application in eGrants. So that really concludes what I have. Was meant to just kind of just give you an idea of the things to expect as far as the federal and the state requirements for applying for funding.
Thank you, Megan. We have a little more than 10 minutes before lunch, but we wanted to, since we have this time, give you all the opportunity to ask questions. If you have any that are burning that are relevant to what you've heard this morning, we can certainly allow you to approach a mic, or if you're fine yelling out, I think the acoustics are pretty good in here, so feel free to shout out questions, and we'll pass the mic to the person that's most suited to answer those questions. Julie.
So, hi. First of all, I just want to clarify that the two-year $500,000 opportunity is for state commissions. When and if we are awarded that grant, we will put it out to the field in New York State, as Megan and Anthony have laid out. So I think a useful benchmark for how much is this, that the commission requires that every program that we fund for AmeriCorps has a minimum of 10 what's called member service years, which is a very complex concept that you can best relate, those of you who are in management, to an FTE, a full-time equivalent. So AmeriCorps member terms can be divided up into 900 hours and 300 hours and many different levels per year, but it all has to add up to at least 10 full positions. And each of those positions would have a minimum, and I don't know what it is off the top of my head, but a minimum cost per MSY. So I'm going to have to rely on someone on my staff to tell me what it is this year. But you multiply 10 times the minimum cost per member service year, and you get what would be the minimum grant. Do we also have a maximum for the Youth Mental Health Corps? Pardon me?
I think typically we don't fund more than 50 MSYs for
Right.
a brand new program. You know, we just don't want people to bite off more than they can chew. But also we're hoping to supplement the federal money with the Schultz and Pinterest money. So the cost per MSY hopefully will be a little richer if we get this grant. You know, that's how we expect to roll it out in our formula RFP in the spring. I mean, if I can help you, Linda, I think
Please.
we don't have a target because we want people to apply. We want there to be interest throughout the state. We want, you know, there to be viable programs throughout the state. And so we're not, we're going to try to spend this money that we have access to on good programs throughout the state. And so we would encourage you, if you have a organization, maybe you want to partner, because 10 MSYs can be a lot for a small nonprofit, perhaps, to be able to support. So if you want to partner with other organizations in your region, or, you know, throughout the state, if you want, if you have affiliations and you want to go in on an application, we would encourage you to do that as well.
So let me see if I can sum up all of that. There's a minimum. There's no stated maximum, but there is consideration of capacity of the various organizations to support a number of AmeriCorps members. Intermediaries and collaborations and partnerships and regional collaborations are all very much encouraged, because you can do more with less if you partner with others. So I'm not quite sure. I know there are some AmeriCorps programs in the room, but if you're not familiar with AmeriCorps, it's a very good way to start, to call an AmeriCorps, to reach out to an AmeriCorps program in your community and see if they would be interested in partnering on an application for a youth mental health corps program. Yes, we do. Right.
And one other point I would add that I think might be helpful for folks if you want to get a head start on what to expect in the request for proposal, take a look at AmeriCorps' notice of funding opportunity, which is how the commission gets its funding and then creates an RFP around the broad AmeriCorps program parameters and requirements. So if you Google that, you should be able to find that. We'll be following up with relevant links with all of you that have registered, where you can also get that information, but that would be a good starting point to look at the 2025 Notice of Funding Opportunity issued by AmeriCorps.
And there was well, part of that is going to be dependent upon whether and what we get from our funders, our partners here.
And we are aiming for 75 members in the first year. So we
Okay.
have established that metric through our partners at Schultz and Pinterest. They set a goal for us to hit 75 members in the first year, which we're confident we'll be able to achieve. And then by year 2, have at least 100 or more members.
So that can be intimidating for those of you who are new to AmeriCorps. It can be intimidating for those of you who are experienced in AmeriCorps. So go ahead. Do you want to come down and use the mic? Okay.
Yeah, well, I would start by reiterating the requirements for the Youth Peer Advocate credential, which is to have lived experience and be 18 years old with a high school diploma. A lot of it overlaps with AmeriCorps' requirements to also have a high school diploma and be 18. Beyond that, as we implement, I think there is flexibility, right, to add new components to it. So if the cohort you're working with isn't eligible on those grounds of having lived experience, for instance, we could certainly consider other avenues because it does touch on mental health and addresses the crisis. So we would certainly be open to exploring that as we implement our program.
So I just, as an overall comment, and I know there are other questions, but the beauty of AmeriCorps is that it is designed locally and designed to meet community needs. So we are not going to tell you, you have to have this type of member or that type of member beyond the general broad requirements. We want to hear what you can create. So, and how you envision this working. And we have a lot
No,
of
I'm going to shift gears, but as long as this is on the same topic, please go ahead and.
Willita, go ahead. I think the answer is yes.
Yeah, well, same process as our annual formula request for proposal that Megan talked about.
So you would submit, Willita, I believe, a request to have an additional program, which we would transmit to the federal funding agency. And then you would write, I guess, 2 applications, one for your current program, and that may be in continuation. So, and then a new application for a youth mental health corps program.
And there'll be specific parameters for implementing a youth mental health core program in the RFP. Well, you'll elaborate your program design and how you meet, to the earlier question, how you're going to have individuals that are eligible to earn the YPA credential, how you envision them implementing their service at your site, and then ultimately earning their Youth Peer Advocate professional credential. And that's the other important point, that for this initiative as a whole, it has to lead to a credential, right? So in the case of School of Social Work, that's leading to a credential. So it certainly seems viable. It would be something we would take a look at adding to our our parameters.
Thanks. I have a question, maybe our presenters from this morning could answer, but you gave a really interesting statistic or data point that currently there's only 150 YPAs in the state of New York. And I'm just curious, nationally, where does New York sit? Is that, compared to, excuse me, one of the other 10 participants in your program? Thanks.
So the Youth Peer Advocate certification is pretty unique to New York State. I'm not sure if is that correct there? Yeah. Yeah. And so, in terms of, it's actually one of the reasons that we were really interested in the New York State as a planning state, because it was really looking at this opportunity for young people to be able to go and earn this certification to serve as a peer or near peer support, and at the same time that this certification allowed for Medicaid reimbursable services, so someone is able to find employment after their service. So I would say that New York is a leader in this field and in this work, and we are really excited about that.
And it's worth recognizing our partners too at the New York State Office of Mental Health and their credentialing partner, Families Together in New York State. They laid the groundwork for this, and we're plugging it into AmeriCorps, which is, it really set us up nicely for success as compared to some of our counterparts in other states that maybe didn't have a well-established credential already. The YPA was set up, and it's already working for folks that we just heard from, and I appreciate you sharing that perspective. We're going to hear more from YPAs that have served later on in the afternoon. At this time, we'll break for lunch though, since it's past noon. Oh, I'm sorry, Suzanne, I didn't see you standing there.
That's
Final
correct.
question. Shoot.
I'm Suzanne Eisenberg. I actually sit on the Commission of National Community Service. And actually my question I think is for Fiona and Tara. I'm wondering if there have been any evaluations or reports produced from the states that have already undertaken some of this work, so that we could understand what worked, what didn't, what's challenging, and how we can, as in New York State, fulfill this mandate in the most productive way.
Fiona can talk a little bit about what the partners are funding. I'll say we're right in the middle, so members started in August, so we're essentially in the middle of the first year, but they've done a lot of thoughtful work. She can talk about in terms of how we're tracking findings. I'll say for AmeriCorps, the agency, we have been looking particularly at Public Health AmeriCorps, where we are funding a longer-term study to track those members post-service. So AmeriCorps does some of that. I will say it's definitely an area we can improve in. Tracking alumni long-term. So we know the vast majority intend to stay in the public sector, and anecdotally, and from some of our larger grantees, we know that, but we don't have the full survey data. So Public Health AmeriCorps has been tracking that to see how many people stay in public health, how many of them choose to go into higher ed, how many of them stay directly in the workforce. So we're anticipating, I think, the first tranche of that study within the next few months, and then longer term, and then on the more qualitative side, I'll say one of the big things we've been seeing through Public Health AmeriCorps in terms of the connection to workforce is that it has to happen pretty hyper-locally because of the way workforce is driven and jobs are local, and most folks who are serving who have lived experience want to stay in their community. And so we've been doing a lot of work with how do we have external funding partners support some of that on the ground and local networking. So if we know the LA Health Department has Public Health AmeriCorps members, how are they connecting them with the LA Unified School District already, or how do we help leverage those relationships? And so a lot of that has been more like we have been really focused on what is the transition to workforce look like, because we thought that has been where some of the biggest challenges are.
Yeah, and as Tara mentioned, we're really halfway through the first cohort of the Youth Mental Health Corps members, and measuring outcomes for members and also communities is something that is really important to us. Both so that we can learn about what is working and what isn't, as Suzanne mentioned, and be able to go improve on that in future years, but also so that we can go and think about what the sustainability of this looks like, so that others can go and both build out programs, but also to go and look at securing additional funding
for local youth mental health core programs. So building off of the the public health AmeriCorps model, we are doing member surveys right now. So we can go and do a baseline survey for members as they're entering service, do an exit survey as they're leaving, and then also do a 6-month post-service survey so that we're able to go and track what members' aspirations, career outcomes, and education outcomes are. And then at the same time, we're currently looking at different research partners to be able to go and help us assess what the community impact is as well.
All right, thank you so much for your questions. We'll have another opportunity for Q&A to wrap up our forum this afternoon, but lunch is now served, so we'll reconvene in the auditorium at 1 p.m. Thanks, everyone.